Assalamualaikum warahmatullahi wabarakatuh. We are from AS1203I and today we are going to talk about our research for our case study for subject BIO270. And our title for our case study is Hypotension. So these are our group members: Hatfina Munifa binti Marzuki, Nur Fariha binti Abdul Fatin Izati binti Isa, Puteri Nur Farah Fazona binti Norman, Nur Aliyah Maisarah binti Bakrulaini, and Fatin Naziha binti Yahya.
Introduction. Low blood pressure is a condition in which the force of the blood pushing against the artery walls is too low. It is also called hypotension. Blood pressure is measured in millimeters of mercury. In general, low blood pressure is a reading lower than 90-60 millimeters of mercury. Hypotension can impact individuals of any age and background depending on the underlying cause. However, it is more likely to lead to symptoms in those over 50, particularly orthostatic hypotension. It can also occur without symptoms in people who are highly physically active, which is more common among younger individuals. Why is it important to study hypotension? Studying hypotension, abnormally low blood pressure, is crucial due to its significant health implication and the insights it provides into various medical conditions. Here is why it is important. The first one is understanding symptoms and risks. Hypotension can lead to dizziness, fainting, fatigue, blurred vision, and confusing, which may interfere with daily activities and increase the risk of accidents or injuries. The second one is preventing organ damage. Chronic or severe hypotension can reduce blood flow to vital organs like the brain, heart, and kidneys, potentially causing long-term damage or organ failure. The next one is identifying underlying conditions. Hypotension may indicate underlying health issues such as heart disease, endocrine disorders, dehydration, or sepsis. Studying it aids in early diagnosis and treatment of these conditions. Let's move to the case background. A 52-year-old woman came in with general tiredness, headaches, and occasional dizziness for the past 3 months. She also had some stomach discomfort, loss of appetite, and weight loss due to feeling nauseous. Her mood had been low, she felt more tired than usual, and her skin and hair felt different. She had been generally healthy before, ate a balanced diet, and was not taking any regular medication. Her period stopped 3 years ago, and her menopausal symptoms had improved since. She seemed worried and frustrated, having researched possible causes for her symptoms. She doesn't know why she might have anemia and has no family history of thyroid problems, but she would like to rule out these two possibilities. The examination didn't show anything unusual. Her sitting blood pressure was 124/74 millimeters mercury. Pulse rate was regular at 66 beats per minute. BMI was 22 kg per meter squared. There was no noticeable goiter. Her skin looked normal but slightly pale, and her abdominal check was normal. There was no weakness in her limbs, and a robot balance test was negative. Her ear, nose, and throat exam, along with a quick check of her cranial nerves, were all normal. A urine dipstick showed no issues. The challenge with this type of case is that the symptoms are vague and could be linked to common short-term issues that resolve on their own without any major underlying health conditions. She hadn't had any tests in over 10 years, so it made sense to order a range of tests: full blood count (FBC), ferritin, liver function, kidney function, blood sugar, thyroid function, and markers of inflammation (CRP and ESR). At her follow-up the next week, most of her test results were normal, except for slightly elevated liver function test (LFTS), low sodium 133 mmol, and mild increase in potassium. However, when her blood pressure was checked again while standing, it dropped significantly from 120 72 millimeters mercury to 92 60 millimeter mercury, which is low.
Now let's move to our next slide, which is pathophysiology. Pathophysiology of hypotension. Hypotension, defined as abnormally low blood pressure, occurs when the circulatory system fails to maintain sufficient pressure to ensure adequate blood flow and oxygen delivery to vital organs. Now we move to mechanism of hypotension. For example, reduced cardiac output. A decrease in the heart's ability to pump blood, often due to conditions like heart failure, arrhythmias, or myocardial infarction, reduce systemic blood pressure. Another thing is decreased peripheral resistance. Excessive vasodilation, as seen in septic or anaphylactic shock, leads to reduced vascular tone and lower blood pressure. In addition, reduced blood volume is also one of the mechanisms of hypotension. Significant loss of blood or fluids, for example, hemorrhage or dehydration, decrease the circulating volume leading to hypotension. And lastly, reduced blood flow to vital organs. The vital organs is the brain, heart, and kidneys. These organs are particularly sensitive to reduced perfusion. For example, brain. Hypotension can lead to cerebral hypoperfusion, causing symptoms like dizziness, confusion, or syncope. And for the heart, decreased coronary perfusion may lead to ischemia, angina, or exacerbation of heart failure. And lastly, for the kidneys, insufficient renal perfusion can cause acute kidney injury, AKI, or impaired waste excretion.
Now, let's take a look at the types of hypotension. First, we have orthostatic hypotension. It is also known as postural hypotension. It's a sudden drop in a blood pressure when standing up from a sitting or lying position. Common causes include dehydration, prolonged bed rest, pregnancy, certain medical conditions such as heart disease, diabetes, and nervous system disorders, and medications. This condition is particularly prevalent among adults. Studies indicate that orthostatic hypotension affects approximately 20% of individuals aged 60 years and older, with higher prevalence in nursing homes and hospital settings. The second one, we have postprandial hypotension. It refers to a significant drop in a blood pressure occurring 1 to 2 hours after eating. This condition is particularly common in older adults. It predominantly affects older adults, especially those with high blood pressure or neurological disorders such as Parkinson's disease, which impact the autonomic nervous system responsible for regulating involuntary function like heart rate and blood pressure. The management strategies that we can do is first, dietary adjustment. We have to consume smaller, low carbohydrate meals that can mitigate the post-meal drop in the blood pressure. Second, we have to increase our water intake before meals. The third one, we have neurally mediated hypertension. Neurally mediated hypotension is also known as a vasovagal syncope or neurocardiogenic syncope, involves a drop in blood pressure after prolonged standing. This condition results from an abnormal reflex interaction between the heart and the brain, both of which are usually structurally normal. Neurally mediated hypotension primarily affects children and young adults. It is characterized by peripheral vasodilation, which is blood pooling in the extremities, a decrease in blood pressure, and a slow or a lower heart rate upon standing. The condition arises from an abnormal reflex interaction between the heart and the brain, leading to a miscommunication that results in hypotension. So the next one, we are going to talk about severe hypotension or shock. So what is severe hypotension? Severe hypotension is a life-threatening condition where blood pressure drops dangerously low, leading to inadequate blood flow to vital organs. This can result in organ damage and requires immediate medical attention. So what is the causes of the disease? The first one is severe blood loss, which is the major injuries or internal bleeding that can lead to the significant blood loss causing a shock. The next one is severe infection or septic shock, which is the infections that can lead to a systemic inflammatory response, causing blood pressure to drop dangerously low. The next one is allergic reaction or anaphylactic shock, which is the severe allergic reactions that can cause a sudden drops in blood pressure. And the last one is heart problems, or we use the terms of cardiogenic shock, which is where the conditions like heart attacks or severe arrhythmias can impair the heart's ability to pump blood effectively. So this is the list of the symptoms of this disease. The first one is confusion, especially in older adults. The next one is rapid shallow breathing and weak and rapid pulse. The next one is cold and clammy skin and low urine output. And for this slide, we are going to talk about the multiple system atrophy with orthostatic hypotension. So what is it means? The multiple system atrophy with orthostatic hypotension, or MSA-OH, is a rare condition where the brain's control over the automatic body functions like blood pressure regulation deteriorates. This leads to the symptoms such as dizziness or fainting, open standing, urinary issues, and movement difficulties. So the key feature of this disease is orthostatic hypotension, where a significant drop in blood pressure when standing, causing dizziness or fainting. The next one is the autonomic dysfunction, which is the problems with automatic body functions, including urinary incontinence and sexual dysfunction. The next one is the motor symptoms, which is the movement issues like stiffness, slow movement, and balance problems. So the management strategies for this disease that our body can do is blood pressure support, which is it will increasing the dietary salt and fluid intake that can help raise blood pressure in our body. So the last one is the lifestyle modification, which is wearing the compression garments, elevating the head of the bed, and avoiding sudden position changes that can assist in managing orthostatic hypotension.
Causes of hypotension. Dehydration. This phenomenon occurs when the body loses more fluids than it takes in, leading to a deficit that can affect bodily function. Excessive fluids loss can significantly reduce blood volume. A lower blood volume reduces the amount of blood circulating in the vessels, which leading to decreased pressure against the vessel's wall. Heart problem, heart muscle damage, leading to a decreased ability to pump the blood. Less blood delivered to the body can cause of low blood pressure. Arrhythmias, which is abnormal heart rhythm. This can cause fluctuation in blood pressure, which is disrupt the heart's pumping efficiency. It can lead to a persistent hypotension if the heart is unable to supply enough blood to some circumstances. Medical conditions. Propranolol is known as beta blockers, which is it can reduce the heart rate potentially lowering pressure. Hydrochlorothiazide. This medication helps eliminate excess fluids from the body but can lead to dehydration and decreased blood volume. Next, we will see about the complications of hypotension. The first is falls and injuries. When you are in hypotension condition, you will feel dizziness and lightheadedness which can lead to falls. Falls can result in serious injuries including fractures and head trauma. The second is stroke. Fluctuation in blood pressure can reduce the blood flow to the brain, which is increasing the risk of stroke. This is especially relevant in conditions like orthostatic hypotension, where blood pressure drops upon standing. The third is fatigue and weakness. The body isn't getting enough blood flow to deliver the oxygen and nutrients the body and muscles need to function properly. This constant fatigue can make it hard to keep up with daily tasks and overall quality of life.
Now, I would like to present about the management and treatment of hypertension. People with hypertension should change their lifestyle and also get medical treatment to alleviate symptoms and prevent from any complication. So for the first one, lifestyle modification. People with hypertension need to increase salt intake and also fluid intake to increase blood volume and prevent from dehydration. They also need to avoid sudden position change by rise slowly from a sitting or lying position to avoid dizziness. They also need to wear compression stockings to reduce the pooling of blood in the leg and relieve the symptoms of orthostatic hypotension. For medical treatment, people with hypertension need to do medication to raise blood pressure, such as fludrocortisone, and they need to treat underlying causes like dehydration and hormone disorder.
Now, let's discuss a few things. We shall see about importance of early detection. So, early detection of hypertension is crucial for preventing serious health complications such as dizziness, fainting, and shock. Regular monitoring and awareness can lead to timely intervention, improving patient outcomes. Next, let's see the broader implication of early detection in managing hypertension. So first, we got public education. So educating the public about hypertension enables individuals to recognize symptoms and seek appropriate care. Awareness campaign can promote lifestyles that change that help manage low blood pressure, such as adequate hydration and balanced nutrition. Second one is healthcare training. So training healthcare professionals to identify and manage hypertension effectively ensures early detection and appropriate intervention, enhancing patient care. And finally, for the conclusion, hypotension or low blood pressure is a condition where it can be harmless or serious depending on the underlying causes and symptoms. Early recognition and appropriate management are key to prevent the complication. By staying informed and taking proactive steps such as maintaining hydration and seeking medical advice when necessary, both patients and healthcare providers can work together to ensure better health outcomes.